Thyroid. This is Pack 365. Myself Srija. Today in the session, you're going to learn about Musculoskeletal System CPT coding guidelines regarding surgery. So what is musculoskeletal system? The system includes bones, muscles, joints, tendons, ligaments and cartilage. So its main functions are movement, support and protection of the organs. So CPT codes 20,000 series, that is 20,100 to 29,999 codes. These are used for the surgeries involving bones, joints, muscles, tendons and ligaments. So these codes, they are used by orthopedic surgeons, trauma surgeons and general surgeons. So what are the important notes before going into code ranges? Headings and subheadings. So the CPT book is divided into sections and subsections. So some subsections have asterisk symbol. So this means a special rules or special instructions apply. So always read the guidelines before coding. So what are the special notes and guidelines? So before each subsection, CPT gives instructions. So these tell you what is included, what is excluded, when separate coding is not allowed. So never skip the guidelines. They can change how you code. So code numbers may not be in order. So CPT codes, they are listed by body part or procedure type. So code numbers may look out of sequence. Some numbers may repeat in another subsection. So this is very normal in CPT but not a mistake. So here the breakdown of subsections. So the subsections are divided into musculoskeletal system based upon the region, based upon the location of the bones and skeletons and also muscles. So general category, what is the code range for general category? 20,100 to 20,999. So this covers basic surgical procedures. So these are used as a foundation for musculoskeletal surgery coding. And the first procedure type is incision. So incision, it covers under ranges of 20,100 to 20,103. So incision is nothing but it's a cutting into tissue to explore or drain. So there is no removal of tissue. For example, incision and drainage of a deep muscle abscess. And second procedure is wound exploration, trauma. So wound exploration, it is used for traumatic injuries. Examples are gunshot wound, stab wound. So asterisk means special rules apply. For example, surgical exploration of a penetrating thigh wound. Next procedure is excision. The code ranges are 20,150 to 20,251. So excision is a removal of tissue. This can include muscle, bone, soft tissue lesions. For example, excision of a tumor for muscle. And next procedure is introduction or removal. 20,500 to 20,705 code ranges. So introduction or removal means placing or removing something from the body. So it includes injections, removal of the foreign bodies. For example, injection into a tendon sheet present in the bone. And replantation, reattachment of a body part. So reimplantation, it's a very complex procedure. Example, reattachment of a finger after a traumatic amputation. The code ranges are 20,802 to 20,838. So here there are some pictures which showing the 206 bones within the human body, the left side picture, and the right side it shows the anterior view of the skull, posterior view of the skull and back view of the skull, the lateral view of the skull. So anterior, lateral and posterior. So in this picture, in the left side picture, you can see 206 bones, the names of the 206 bones in the human body. So it consists of skull, it consists of spinal column and upper extremities, lower extremities. So in spinal column, it is divided into cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum and coccyx. So clavicle, manubrium, scapula, sternum, these are the shoulder bones, and ribs, these are under the diaphragm in the chest cavity. So skull, it's a bone, cranium bone in the skull. So mandibles are present within the jaw, in the mouth. And humerus, ulna, radius, these are the upper extremity bones. Pelvic girdle, it's a pelvic girdle, it's a bone within the pelvic cavity. So carpals, metacarpals, phalanges, these are the hand bones, finger bones. So femur, it's a thigh bone, which is the largest bone in the human body. Patella, it's a kneecap, and tibula, fibula, these are the lower extremity bones. So tarsals, metatarsal, phalanges, these are the foot bones. And coming to anterior, lateral, and posterior view of the skull, we have frontal bones, parietal bones, temporal, sphenoid, zygomatic, and maxilla, and mandible. We also have this mastoid process, styloid process within the lateral view of the skull. So next code ranges after grafts or implants. So what is a graft? So this is used when a tissue or material is placed into the body. So this can be a bone graft, muscle graft, and synthetic implant. So for example, bone graft used to repair a skull defect, and other procedures. So other procedures, these are listed under 20,950 to 20,999 code ranges. So procedures which do not fit neatly into incision, excision, or graft categories, these are placed under other procedures category. Example like specialized corrective procedures. And first region is head. So the procedures which are done under head are listed under the code ranges 21,010 to 21,499. So CPD codes for head, skull, and facial bones. So it includes trauma, tumors, and deformities. So incision 21,010 code is a simple surgical cut into head tissues. There is no tissue removal within the incision. And excision, removal of tissue or bone from the head. The code ranges are 21,011 to 21,070. Example, excision of the skull lesion or a facial tumor. Manipulation, 21,073. Adjustment without cutting. So manipulation is adjustment without cutting. So this is used to correct the deformity or a position. The code range is 21,073. Head processes. 21,076 to 21,089 code range. So what is a head processes? It's an artificial replacement of part of the skull or a face. So this is often used after a trauma or a tumor removal. For example, cranial plate placement. And other procedures are listed under 21,089 code category. Next is introduction or removal. So insertion or removal of the devices or materials. The code ranges are 21,100 to 21,116. Next is repair, revision, and or reconstruction. 21,120 to 21,296. So fixing or rebuilding bones or tissues. It includes cosmetic and reconstructive surgery. For example, facial reconstruction after a trauma. Other procedures is 21,299. And next is fracture and or dislocation codes listed under 21,315 code to 21,497 code ranges. So fracture and or dislocation is a treatment of a broken or dislocated bones. So this can be a closed approach. It can also be an open approach. So for closed treatment, there would be no surgery. For open approach, it would be a surgical repair. For example, repair of a fractured jaw. And other procedures are listed under 21,499 code ranges. And next region, next part is neck and thorax. So neck is a soft tissue, and this region covers neck muscle, soft tissues, ribs, sternum. So it also includes the trauma, tumor removal, and reconstruction. The code range is 21,501 to 21,899. So CPD codes, they are grouped by the body part first, then the type of procedure. Where head, neck, thorax. What? Incision, excision, repair. Why? Because it's a trauma related to deformity or a disease. So what are the procedures done under neck and thorax? Excision, incision, repair, revision and or reconstruction, fracture and or dislocation, and other procedures. So incision, simple cutting to soft tissues of the neck or a chest wall. There is no tissue removal, and the code ranges are 21,501 to 21,510. Example is incision to drain a deep neck abscess, and excision 21,550 to 20,630. Excision is it's a removal of tissue. Maybe it is in the form of mass, tumor, or cyst from the neck or thorax. Example, excision of a neck tumor. And repair, revision, and or reconstruction. It is a fixing or rebuilding the damaged tissues, often after the trauma or surgery. And the code ranges are 21,685 to 21,750. So example, reconstruction of a chest wall defect. And next is fracture and or dislocation. 21,811 to 21,825 code ranges. So what do you mean by fracture and or dislocation? It's a treatment. It's a treatment of rib or thoracic bone fractures, right? So the other procedures are listed under 21,899. The procedures related to neck or thorax. And next region is back and flank. The code ranges are 21,920 to 21,936. So this back and flank, it only involve excision procedure processes. So excision in this, removal of soft tissue masses from back or flank. For example, excision of the lipoma, a tumor from the upper back. So these codes are based upon the size and depth of the mass. And next region is spine or vertebral column. So the code ranges are 22,010 to 22,899. So what does this spine or vertebral column include? It covers cervical vertebrae, thoracic vertebrae, lumbar vertebrae and sacral vertebrae, nothing but the spine. So spine coding is complex and it must be done carefully. So what are the procedures under spine? Incision, excision, osteotomy, fracture and or dislocation as well as manipulation. So incision is a surgical opening of the spine tissues. There is no removal of bone or the disc. For example, incision to explore the spinal structures. Excision, 22,100 to 22,116 code ranges. So it's a removal of vertebrae or a spinal lesion. Example, removal of a spinal tumor. And next procedure is osteotomy. So the name osteo means it's a root word for bone and tummy is cutting. So it's a cutting and reshaping the bone. So this is done, osteotomy is done to correct the deformity of the bone shape and structure. For example, surgical correction of a spinal curvature. Fracture and or dislocation. So under this category, treatment of broken or displaced vertebrae is given. So the approach may be a closed treatment or it can also be an open surgical repair. For example, surgery for vertebral compression fracture. And the code ranges are 22,310 to 22,328. So next is manipulation. The code is 22,505. So manipulation is the manual correction without surgery. So without performing a surgery, a bone or a muscle shape and structure can be corrected. So that comes under manipulation. So it is often under anesthesia. So often done under anesthesia. For example, manipulation of the spine for alignment. So in the right side, you can see the pictures of the spinal or the vertebral column and also the intervertebral disc and ligaments. So in the spinal column, it shows you the cervical, thoracic, lumbar and sacral cochlear vertebrae. So in the B picture, it shows you parts of the vertebra. So what are the parts of the vertebra? Body, spinous process, transverse process, lamina and pedicle. So these are all the parts of the vertebra. And intervertebral disc and ligaments is the picture shown in the seed label. So intervertebral disc, anterior longitudinal ligament, we have posterior longitudinal ligament. So it's a vertebral body. And next coming to percutaneous vertebroplasty and vertebral augmentation. So the code ranges are 22,510 to 22,515. So this is a minimally invasive spine procedures. So in these procedures, bone cement is injected into a collapsed vertebra. This is used mainly for osteoporotic compression fractures. For example, cement injection to stabilize a fractured vertebra. Percutaneous augmentation and annuloplasty. 22,526 to 22,527. It strengthens the intervertebral disc. It is used for chronic disc pain. So next procedure, arthrodesis. So what do you mean by arthrodesis? Fusion. So it's a fusion of two or more vertebrae. So it stops the movement to reduce the pain. It can also be cervical, thoracic or lumbar. And the orthodesis code ranges are 22,532 to 22,819. So lumbar spinal fusion for instability. So requires arthrodesis codes, requires careful attention to level sign what approach is done. So there are spine surgical approach techniques. So these codes describe how the surgeon reaches the spine. We have three types of approaches. lateral extracavitary approach, anterior or anterolateral, posterior or posterolateral, or lateral transverse. So lateral extracavitary approach is its access from the side. So this is used for complex spine surgery. The core ranges are 22-532 to 22-534. Anterior or anterolateral approach technique. This is access from the front to front side. And the core ranges are 22-548 to 22-586. And then lateral or extracavitary approach, anterior or anterolateral cavity approach, posterior or posterolateral or lateral transverse process technique. So posterior or posterolateral is the access from the back. Posterior means backwards. So back of the body. So always remember, approach matters in the CPT spine coding. So the code ranges for posterior approach is 22-590 to 22-634. And next is spine deformity. For example, scoliosis and kyphosis. The code ranges are 22,800 to 22,819. So spine deformity is a correction of abnormal spinal curves. So there will be a surgery done to straighten the scoliosis, to straighten the curvature of the spine. And next procedure under spine is exploration. So exploration coded under 22-830 code. It's a surgical inspection of the spine. There is no major repair performed. And spinal instrumentation codes 22,840 to 22,870 code range. So spinal instrumentation, it involves the placement of rods, screws and plates. It usually reported in addition to the fusion codes. For example, pedicle screw placement. And other procedures 22,899. So these are the unlisted spine procedures. So these are used when no specific CPT code exists. And next region is abdomen. The code ranges are 22,900 to 22,999. So it involves excision 22,900 to 22,905 code range. So excision is a removal of soft tissue tumors from abdominal wall. For example, excision of the abdominal wall mass. And the other procedures are unlisted abdominal musculoskeletal procedures. And next region is shoulder. So shoulder codes are ranges from 23,000 to 23,929 code ranges. So this shoulder, it covers shoulder joint, muscles, tendons and ligaments. So shoulder codes, they include rotator cuff repair, shoulder reconstruction, fracture treatment, which is very common in orthopedic coding. So incision. So shoulder section includes procedure involving shoulder joint, rotator cuff, tendons, ligaments and muscles, shoulder bones such as scapula, clavicle, humerus and head. So incision is a simple surgical opening. It is used to drain the infection or explore the tissues. And there is no tissue removed in the incision. The code ranges are 23,000 to 23,044. And excision, removal of tissue or bone from the shoulder mass. The code ranges are 23,065 to 23,220. Introduction or removal, repair, revision and or reconstruction, fracture and or dislocation. The treatment of the shoulder fractures, shoulder dislocations, they can be closed or opened. For example, reduction of the shoulder dislocation. The code range is 23,500 to 23,680. So next is manipulation, the manual correction of the shoulder under anesthesia. There is no incision in the manipulation. Orthodesis, fusion of the shoulder joint. The code ranges are 23,800 to 23,802. These are the orthodesis codes. So it stops the movement to reduce the pain. For example, shoulder joint fusion. Amputation. So amputation code ranges are from 23,900 to 23,921. So it's a partial or complete removal of shoulder or the upper arm. So amputation is rare, but it is important in trauma cases. For example, traumatic shoulder amputation repair. And other procedures, 23,929. These are unlisted shoulder procedures. And next region coding is humerus, the upper arm and elbow. So they cover upper arm bone, which is a humerus bone, and elbow joint, and also the surrounding muscles and tendons. So the code ranges are 23,930 to 24,999. So incision, it includes surgical opening of the upper arm as well as the elbow. So this is often for drainage or exploration. For example, drainage of the elbow infection. Excision. The core ranges are 24,065 to 24,155. So excision involves removal of the bone lesions, soft tissue masses, damaged tissue, for example, excision of the elbow tumor. And introduction or removal, placement or removal of the implants or foreign bodies. The core ranges are 24,160 to 24,220. And next procedures under humerus and elbow is repair, revision and or reconstruction, where fixing or rebuilding elbow structures takes place. Fracture and or dislocation, where treatment of broken or dislocated elbow is given. So this process may be a closed approach or an open approach. And orthodesis codes are 24,800 to 24,802. So it's a fusion of the elbow joint. So orthodesis stops the movement to relieve the severe pain. For example, elbow joint fusion in the arthritis. And amputation codes are 24,900 to 24,940. So amputation is a partial or complete removal of the elbow or forearm. So it is usually due to trauma or severe infection. So forearm and wrist is the next region codes. So 25,000 to 25,999 codes are for forearm and wrist. So this section includes the forearm bones, radius and ulna, wrist joint, tendons, nerves and blood vessels. So incision codes are 25,000 to 25,040. So it includes simple surgical opening. It is used for drainage or exploration. Excision. Excision is it's a removal of tissue or bone. It includes cysts, tumors and damaged tissue. Introduction or removal. Code ranges are 25,246 to 25,259. Repair, revision and or reconstruction. The code ranges are 25,260 to 25,492. So these are most commonly tested section. It includes tendon repair, nerve repair and carpal tunnel surgery. For example, carpal tunnel release, nothing but the release of the median nerve. Fracture and or dislocation. Code ranges are 25,500 to 25,695. So fracture and or dislocation codes involve the treatment of forearm fractures. Wrist fractures are very common in this forearm and wrist. So for example, distal radius fracture repair. And amputation, arthrodesis. So arthrodesis is fusion of the wrist joints. This is used in severe arthritis or trauma. Amputation, partial or removal, complete removal of the forearm or hand. So the code ranges are from 25,900 to 25,931. Here is a picture at the right side which shows you the bones, tendons, nerves and carpal tunnels. So in this the bones of phalanges, metacarpals and carpals are the bones of the forearm and wrist. So tendons are the flexor tendons and nerves you can see the median nerve, ulnar nerve and carpal tunnel. These are the space where median nerve passes. So this is very important for understanding the carpal tunnel syndrome. And what are the other procedures listed? Comes under 25,999 code. And next region is hand and fingers. The code ranges are 26,010 to 26,989. So the CPT codes, they are used for procedures on the fingers, nothing but phalanges, palm and hand bones, metacarpals, joints, tendons, nerves of the hand. So incision, the same procedure in every region is incision, excision, introduction or removal, repair, revision, fracture, orthodesis, amputation and other procedures. So every region of the coding has all these procedures repeated. So incision is simple cut or opening of the hand or finger. So this is usually for drainage or exploration. So for example, drainage of finger abscess. Excision, 26,100 to 26,262 code range. It includes the removal of tissue, cyst, tumor or a part of a bone. For example, excision of the ganglion cyst from finger. Introduction and removal codes are 26,320. Repair, revision and or reconstruction of the hand and fingers are coded under categories 26,340 to 26,596. So fracture and or dislocation codes are 26,600 to 26,785. Orthodesis 26,820 to 26,863. Amputation 26,910 to 26,952. And other procedures are listed under 26,989. So in the right side, you can see the bones of the hand picture. So phalanges, metacarpals and carpals, these are the bones of the fingers and hand. So we can see the ulna and radius, which are the largest bones of the hand. So you can see the distal phalanx, middle phalanx and proximal phalanx here. And there are fusion of wrist bones, hamate bone, pisiform, triquetral, lunate, trapezoid, trapezium, capitate, scapuloid. So these bones, they together form the wrist. And next region is pelvis and hip joint. So pelvis and hip joint codes, they involve 26,990 code range to 27,299. So this section includes hip joint, pelvic bones, surrounding muscles and ligaments. So incision is 26,990 to 27,036 code range. So incision, it's an opening of the pelvis or hip area. It is often for drainage or exploration. For example, drainage of hip abscess. Excision. So excision involves the removal of tissue or bone. For example, tumors, infected tissue and bursa. So the code ranges are 27,040 to 27,080. And next procedures are introduction or removal, repair, revision and reconstruction, which are coded under 27,097 to 27,187. So manipulation codes are 27,275, orthodesis 27,278 to 27,286 codes, amputation 27,290, 27,295. And next region is femur, which is a thigh region and knee joint. The code ranges are 27,301 to 27,599. So this section is only for thigh bone and knee surgeries. So incision, it involves the cutting into tissue to explore or drain off the femur bone and knee joint bone. For example, draining infection, exploring the knee joint. Excision, example is cut and remove of the thigh bone or knee joint bone. Introduction or removal, inserting or removing the devices, especially in the femur or knee. So the code ranges are 27,369 to 27,372. So examples of the introduction or removal is injecting the medication and removing the knee implants. So repair, revision and or reconstruction, fixing or rebuilding the knee ligaments or structures. Example, meniscus repair and ligament reconstruction. So fracture and or dislocation, the code ranges are from 27,500 to 27,566. So it means treating the broken femur or knee dislocation. For example, femur shaft fracture repair and knee joint dislocation treatment. So next code ranges are for the region of leg and ankle joint. So leg and ankle joint, the code range is 27,600 to 27,899. So these codes focus specifically on lower leg and ankle surgeries. So we have incision, excision, introduction or removal, repair, revision and or reconstruction, fracture and or dislocation procedures. So we do have manipulation, 27,860 code and orthodesis, 27,870 series and amputation and other procedures listed under leg and ankle joint. So here at the right side, you can see the muscles and bones of the leg, tibula and fibula. So here you can see the muscles which are for the present on the foot. So you can see interior extensor retinaculum, you can see peroneus brevis tendon muscle, extensor digitorum brevis muscles, flexor hallucis longus tendon muscles. So these are all the muscles present on the foot bone. You can also see the bones present in the leg, toes, metatarsal bones, phalanges bones, tarsals, metatarsals, phalanges, and you can see the tarso-metatarsal joint where metatarsals and tarsals are joined, and you can see the middle phalanx and distal phalanx bones clearly in this diagram. foot and toes. So this section includes surgeries of the foot bones, toes, toe joints and soft tissues of the foot. So it also includes the procedures, incision, excision, introduction or removal, repair, revision and or reconstruction, fracture and or dislocation, which are coded under 28,400 to 28,675 code range. And orthodesis, it's a fusion of the foot joints and toe muscles. So they are coded under 28,705 to 28,760 code range. So next category is application of the cast and strapping. So the code ranges are 29,000 to 29,799. So these codes are not surgeries, but they are the supporting treatments. For body and upper extremity, the code range is 29,000 to 29,280. So cast or strapping applied to arm, shoulder and upper body. So cast is nothing but it's a applying a hard cast to protect the bone. So a material which is used to protect the bone. So it keeps the limb in position. So the code ranges are 29,000 to 29,086 codes. So splints. So next is splint. So splint is it's applying a temporary support. So this is very less rigid than a cast. For example, short leg splint, finger splint and ankle splint. So the code ranges are 29,105 to 29,131. So application of cast, splint and strapping. So these codes they offer supportive orthopedic care but not for major surgery. So strapping, any age, the code range is 29,200 to 29,280. So what is the meaning? Using tape or elastic bandage to support the joints or muscles. So usage of a tape or a elastic bandage. So there is no hard material like a cast or a splint. For example, shoulder strapping, knee strapping and ankle strapping. So this is used for any age. So same codes for children and adults. So next is lower extremity code range 29,305 to 29,584 codes. So this section is only for legs and feet. It includes cast, splint and strapping. So next is cast range is 29,305 to 29,450. Splints 29,505 to 29,515. So splint is applying a temporary non-circumferential support. So remember, splint is always less rigid than a cast. So it allows the swelling. For example, posterior leg splint and ankle splint. Removal or repair. It comes under categories 29,700 to 29,750. So removal or repair includes removing or fixing of the cast, splint and straps. For example, removing a leg cast, repairing a broken cast. And this is often not separately payable if it is included in the global care. And other procedures, 29,799. So it is unlisted orthopedic procedure. So this is used when no exact CPT code exists. And the last category is endoscopy or arthroscopy, which are listed under 29,800 to 29,999 code ranges. So what do you mean by endoscopy or arthroscopy? Using a camera, using a scope to see and treat the joints through a small cuts. So arthroscopy is the endoscopy of joints. So what are the common joints? Knee, shoulder, ankle. So the examples are knee arthroscopy, meniscus repair, ACL evaluation. So it is a less pain procedure and faster recovery than the open surgery. So these are the front view of the muscles of the body and this is the back view. So the anterior view of all the muscles present in a human body and posterior view of all the muscles present in the human body. So you can see here the frontalis muscle, flexor digitorum superficial muscles and biceps brachii, triceps brachii, rectus abdominis, gluteus medius muscles, extensor digitorum, abductor pollicis. So we have different muscles located in different locations of the body. So coming to posterior muscles and anterior muscles, both are different in names. So this is for today's session. I hope the session has helped you. So the next session, you will be learning about the definitions of the procedures which are done in the musculoskeletal system surgery in the CPT coding. Thank you.